Hola, buenos días, buenas tardes
Good
a todos.
morning, good afternoon to all of you. Welcome to PAHO's press briefing on the COVID-19 pandemic in the Americas. Today is Wednesday, February 23rd, 2022, and my name is Luciana Viegas, Public Affairs Advisor with PAHO. We have interpretation into English, Portuguese, French, and Spanish, and you can find that at the interpretation button. We have received several questions via email. I would like to thank the journalists that sent their questions ahead of time, and you will also be able to ask your questions by using the Q&A button. Please remember to include your name and media outlet when sending your question. Today, PAHO's director, Dr. Carissa Etienne, will be updating us on the COVID-19 situation in the Americas, and she will also be focusing on the sub-region of the Caribbean. Together with Dr. Carissa Etienne, we have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Health Emergencies Director, and Dr. Sylvain Aldhigieri, Incident Manager for COVID-19 with PAHO. So we will have now the opening remarks by Dr. Etienne, and we will move on to the questions after that. Dr. Etienne.
Good morning, and thank you for joining today's press briefing. Last week, there were 2.2 million new COVID cases in the region, a 28% decline as compared to the previous week. And after 6 consecutive weeks of increases, we saw deaths fall for the first time since the beginning of the Omicron wave to 29,000 new deaths reported in our region, a drop of 9%. But many places are still facing the crest of the infection surge. Although cases dropped by a third across North America, Mexico reported a 70% increase in new infections. And while deaths declined in the United States, these rates are still among the highest that we've seen throughout the pandemic. Across Central America, deaths dropped by 17%. However, Nicaragua saw cases surge by a third. ICU admissions and deaths continued to rise in Honduras. While deaths decreased overall in South America by 13%, some places continue to report spikes. In Chile, for instance, ICU admissions accelerated by a quarter, and deaths increased by 37%. Although new cases dropped across the Caribbean by 44%, more than half of the 13 countries and territories that reported increases in deaths in our region were in the Caribbean. In the Bahamas, the virus continues to hit vulnerable groups. It is estimated that some 10% of healthcare workers are currently in quarantine due to COVID-related exposures. Grenada reported a 50% increase in ICU admissions, while Jamaica's rose by 23%, and Guadeloupe had a 9% rise as compared to the previous week. These trends show that many places are still in the midst of the Omicron surge. So we must stay vigilant and uphold the measures that have been proven to save lives. But today I want to give a specific update on an area that remains especially vulnerable to COVID. My home, the Caribbean. The Caribbean is home to over 44 million people. It is a diverse part of our region with many inequalities that has struggled during the pandemic. So far, we've been able to reach 63% of the eligible population with life-saving COVID vaccines, thanks to the tireless efforts of governments, healthcare workers, and communities. But this is a picture with many contrasts. While 91% of people in the Cayman Islands have been fully vaccinated, less than 1% of Haitians have received all their doses. In fact, out of 13 countries and territories in the Americas that have not yet reached the WHO's goal of 40% coverage, 10 are in the Caribbean. Because of this, today the Caribbean remains especially vulnerable to COVID. And there are varying reasons for the low coverage. Even though limited vaccine supply is less of a barrier now, two conditions that are necessary to scale up campaigns to the farthest corners are still missing. In some countries, vaccination centers are located in central areas, which may be far from the people who need them the most. Also, some countries are short-staffed, with doctors and nurses experiencing severe burnout. And then there are those who remain unvaccinated by choice. And to understand why, our teams have been exploring people's attitudes towards vaccines. In one PAHO study published in The Lancet, we found that the vast majority of health workers are eager to use the vaccine to protect themselves and are doing all they can to reach as many people as possible. But some still want more information. They have questions on potential side effects or on how long the benefits of the vaccine last. These are legitimate questions that must be acknowledged and addressed so that we can better protect our health workers and everyone else. Some people have not gotten vaccinated because they no longer see COVID as a risk to themselves. Yet the spread and death toll of Omicron have shown that underestimating this virus only fuels the pandemic and leads to more suffering. We have the tools to turn the tide on vaccinations in the Caribbean. Nearly 700 million people across our region have already received their full vaccination courses. And over 21 million people in the Caribbean alone, giving us real world data to show that vaccines are safe and effective against COVID-19. And there is much that we can do to reach unvaccinated people. First, we must tailor our interventions to the needs of those who remain vulnerable in each country. In Jamaica, for example, this means reaching out to casual workers and young men who have the lowest vaccination rates in the country. In Trinidad and Tobago, this means engaging nurses who are trusted sources of medical information, but also the health workers most likely to remain unprotected. And in Barbados, which is known for having some of the highest percentage of centenarians in the world, it means protecting those on the cusp of turning 100 years so that they can continue to live healthy lives. Second, we must make it easier for people to get a vaccine closer to home. This can be done by investing in staff and infrastructure to ensure that vaccination centers are closer to the people who need them the most, and that hours of operations are convenient for working adults. We are collaborating with governments across the region to do just that. In Haiti, which remains one of the least vaccinated countries in the world and a top priority for PAHO, we are working tirelessly with partners to establish at least one vaccination site in each commune, enabling us to finally expand coverage well beyond today's very low levels. And lastly, we must also create spaces for open dialogue to address our community's concerns. In one PAHO and UNICEF survey that was supported by USAID, 51% of vaccine hesitant people in the Eastern Caribbean were open to changing their minds after seeing more scientific and medical information. This means working with trusted voices and community leaders to reach people where they are with the right information. Dialogue, trust, and outreach are the tools that we must use to get more vaccines into arms and ultimately to save lives. You know, as a doctor from the Caribbean who has dedicated her life to public health, I want to make a special appeal to the people in the region. The best decision that you can make for your health right now is to get a vaccine against COVID. The pandemic is not over, and a new variant can emerge at any point. If you have been vaccinated, but you know someone who has not been, please reach out to them, listen to their concerns, and share information. Help them find a vaccination site. We have the power as a community to overcome these barriers and reduce the toll of this virus on our people. Thank you.
Thank you. Thank you, Dr. Etienne. We start with a question from the Caribbean, two questions actually very similar. From Kevin Fellman, senior reporter at Guardian Media, Trinidad and Tobago. He asks, vaccinations have slowed significantly in the Caribbean. Does this prolong the pandemic? And also Stephen Cyrillan, PJD2 Radio in St. Martin has asked, we are seeing a rapid decline in Omicron virus. Would it be fair to say that we are at the end of the rope in terms of the virus being better controlled? What are your message to many of the Caribbean and Latin American countries working towards relaxing COVID-19 measures? Dr. Etienne.
Thank you for media specialists in Trinidad and Tobago and St. Martin. Thank you for this question. As I've said before, we really don't know when the pandemic will end. But what we do know is that vaccination is the best way to protect against disease and death from COVID-19. We continue to urge countries in the Caribbean and countries throughout the Americas to fill critical gaps in vaccination coverage. Vaccines are now more widely available, and we should take advantage of that improved supply to expand our immunization efforts. And you heard in the opening remarks, I spoke about the ways that we could do that. We need to focus on expanding coverage in high-risk groups like health workers, the elderly, and immunocompromised persons to help save lives and to shield our hospital capacity. Our hospitals have reached breaking point over and over again. Our healthcare workers are really burnt out. They are exasperated, some of them mentally suffering from depression, etc. So to overcome this pandemic, we have to expand vaccinations to cover everyone who is eligible after we protect these high priority groups. Because of the rapid spread of Omicron and the possibility of other variants, we have to continue effective public health and social measures to drive down transmission. And this we repeat all the time. And let me say that speed is of the essence, because this variant is proof of how quickly the situation can change. So even now, as we are seeing countries reducing public health measures, etc., we need to continue to be vigilant, because there may be the emergence of a new variant that can spread rapidly, that can cause more illness and death. Vigilance is necessary, as well as ensuring our public health measures and vaccinations. Over.
Thank you, Director. Pasamos para una pregunta.
We move on now to a question, a general question that received from several countries, but we are going to Francisco's question from Argentina. What will determine the end of the pandemic? The relaxation of prevention measures in some countries is due to economic reasons, or are they based on scientific reasons? Dr. Aldhigieri, thank you. We should clarify at the outset that the potential lifting of the emergency declaration by WHO does not have any relation to the quote-unquote end of the pandemic. Certainly, there is no projected date for the lifting of that declaration. And finally, WHO's Director General will be making that decision based on recommendations by the experts group with the Emergency Committee on the International Health Regulations. As a matter of fact, it is a mistaken point of view to say that we can be accurate as to when the end of the pandemic will be. There will never be a specific end day. It is quite likely that the SARS-CoV-2 continues to circulate in the foreseeable future, globally, regionally, and locally, as we see it with the seasonal flu viruses. Now, the most credible scenario is for, even in the case of other surges, the impact of the pandemic will gradually diminish globally as time goes by. And when we're talking about impact, we understand the burden of severe disease and also the death toll. However, it is important to highlight that this will change from one country to the other depending on the vaccination coverage reached in each country, and if that coverage is high and standard throughout the various risk groups, and it will also depend on the improvement in the care given to patients, including with the deployment and use of new treatments. Therefore, all of that may even diminish more severe disease and death toll. So even though there may still be circulation, it will be inevitable that in some places there is a perception that the pandemic is no longer having such a burden and that it has come to an end. I hope I addressed the question by the journalist. Thank you. Thank you, Dr. Aldhigieri.
We'll go back now to some questions from Caribbean colleagues. We start with a live question from Kadim Joseph at the Observer Media in Antigua and Barbuda. Kadim, if you hear me, you have the floor.
Unmute. Okay, thank you for having me. Sorry for that a while ago. Vaccination numbers against COVID-19 continue to slow down in Antigua and Barbuda, with just over 61,000 people fully vaccinated thus far. Should there still be an emphasis on getting herd immunity numbers up, or getting to herd immunity, or should countries like ours focus more so on marketing vaccinations to at-risk populations, including children entering schools, as the case is with polio, MMR, and other vaccines like that?
Thank you, Kadim. Dr. Barbosa?
Thank you, Kadim, for these two questions. About the first one, the objective with the vaccine is not to achieve herd immunity. Indeed, the objective of the vaccine is to protect the most vulnerable groups, to prevent the severe cases and deaths. Of course, all the national plans of immunization that the PAHO supported the countries, reviewed, made recommendations, they have some steps. They start vaccinating the elderly people. They moved it to people with some non-communicable diseases. They move it to adults. Now probably they will move it for adolescents and children. So this is based on the risk to develop severe disease and death. Antigua and Barbuda has made a tremendous effort to increase the vaccination. It's important to recognize these efforts, but for sure that we need to achieve a very high and homogeneous immunization coverage, not only with one dose, but with the full scheme in order to protect the people that are most vulnerable. About the second question, I think that's not one or another one. We needed to have both activities. While we are trying to get more people vaccinated against COVID-19, we cannot forget the traditional routine immunization programs that we have, and you mentioned some risks. Polio, we had a new wild polio case in the Africa region reported last week. So this is a risk, and we know that in many countries in the region, the pandemic also impacted in a negative way the routine immunization program. So we are supporting the countries to establish a specific strategy to perform a very thorough analysis about what are the neighborhoods, the communities that are falling behind on the routine vaccination, to adopt strategies going house by house in order to mobilize the children to get them fully vaccinated against these other very important diseases too. So it's not one or another, but both, to work on both sides of this same coin, that is to get people healthy and to let our countries to recover fully of the pandemic. Thank you.
Thank you, Dr. Barbosa. We continue with a question from Ariel Boleg from the Tribune in the Bahamas. Ariel asks, the Bahamas just relaxed restrictions and health officials will continue to recommend relaxed restrictions as the need arises. Does PAHO estimate the Bahamas health official has a good system and is taking a good and measured approach when deciding to relax restrictions? Dr. Ugarte?
Thank you, Luciana. Thank you, Ariel, for this question that also applies to several other countries. And the countries are advised to assess and plan mass gatherings in general based on the epidemiologic situation and the health system's capacity to respond to COVID-19 surges and increase of cases in locations or in entire country. But there are different drivers and the risk tolerance of the communities and the economic impact that is something that we are seeing in many countries are also topics to be considered when a decision is being taken. Particularly, it is necessary to conduct a risk assessment. We said that we have to follow all the epidemiologic situation, but also the capacity of the health services. And by doing that, the countries are advised to regularly adjust their response strategies according to what is the situation. But to analyze what is the situation, there is a need to have a proper surveillance system and proper notification system and proper implementation and measuring what are the impact, the benefits of the social measures, and also the adaptability of the compliance by the population. In that regards, the Bahamas has been demonstrated that these measures have been taken in a careful way, and all the information that we receive and we are following, including, for example, the availability of tests to identify timely identify the new cases and also adjust those measures are considered okay. And the situation in general is that in the carnival, the activities are permitted with participants are aware of the requirements, and also that the participants adhere to the public health measures. For example, when they are in public, when they are in a situation that they are enjoying carnival or other mass gatherings, many of the participants do not use their masks properly. They take off their masks. They, of course, situations where the risk of transmission increases dramatically. So every time when there is a mass gathering planned, there is a need to analyze which are the measures that will be implemented to mitigate the risk of transmission, and also to implement all the surveillance measures to identify early enough the cases that may arise after those mass gatherings. if something we have learned during the pandemic is when we relax the measures, when we are in low transmission levels, usually in 1 or 2 weeks after, the number of cases increases rapidly. And of course, also later on, the number of deaths. So the public health measures need to be implemented. And I understand that many countries in the Caribbean are considering carnival fetes this year, but some countries are delaying and pushing for the summer, which were traditional held prior Ash Wednesday, for example, and Lent. But most will be holding June to August. So there are many measures that can be taken. And this is one way to analyze the risk and also to consider all the traditions in the countries and moving back to reopening some activities in a safer way. Thank you.
Thank you, Dr. Barbosa. Next question we have.
Gracias, Dr. Ugarte.
Asks, sorry, is there any effort to help Caribbean governments access funding to mount public campaigns to encourage vaccinations? Dr. Barbosa?
Thank you for this question. I think that our director in her initial remarks highlighted very clear the challenge that we are facing in the Caribbean countries. We need to increase the immunization coverage. We still have 7 countries in the Caribbean region that are below the target of 40% of immunization coverage. We have identified some of the problems that are related to the vaccine hesitancy. We are working with the Ministry of Health in the Caribbean, and yes, we are mobilizing resources. We received donations from the Canadian government, the US government, and part of these grants are being used to develop more efficient communication strategy. As our director has mentioned already, we needed to engage the healthcare workers because they are the main source that families use to make their decision about having the vaccine. We need also to mobilize all the important stakeholders in the community, like the religious leaders and others. So it's not only a government endeavor, but we really needed to develop and to implement together with the Ministry of Health, and we are working on this comprehensive communication strategy to inform, to mobilize, and to get people's trust on the vaccines that can save their lives. Thank you.
Thank you, Dr. Barbosa. One final question from Caribbean colleagues, from Dana Malcolm from Turks and Caicos Magnetic Media. Dana asks, as restrictions around the world and in the Americas are phased out, what is PAHO doing to ensure that therapeutics to offset the effects of COVID are available and in use in the Americas? Dr. Aldhigieri?
Yes, thank you for this question, because it's important, in addition of the access to vaccine and the good coverage, to work at the same time on therapeutic access and access to therapeutics and the improvement of the management of the patient. So how we work, the PAHO working group on therapeutics that include experts from the academia is reviewing all new options for therapeutics as soon as the evidence is published and published according to the strict protocols. This work is done in close coordination with WHO technical departments. Once new therapeutics are validated and their use are incorporated in existing guidelines that we update on a regular basis, PAHO would work closely with manufacturers in order to ensure an equitable access to these new medications. It's important to note that countries in the region may also produce the product, the new medications, with an agreement with the medicines patent pool. Some products can be considered generic products and may be of importance in ambulatory care for vulnerable groups. I'm thinking about the antivirals, some antivirals. So in this context, really, we urge manufacturers to make available the know-how required for the production of some products, including antivirals, to all countries that need them in this time of pandemic. In addition, the PAHO Strategic Fund continues to negotiate with manufacturers to make available antivirals of proven efficacy to the countries that need them. I hope I have answered the question of a journalist from Turkey and Caicos. Thank you.
Thank you, Dr. Aldhigieri. Pasamos a las preguntas de periodistas de otros países en la región. Empezamos
now questions from other regions. Javier Hernández Garcia from Telesur, Mexico. Javier, you can ask your question live if you want. Yes, good morning. Can you all hear me? Yes, thank you very much. Thank you for giving me the floor. Javier Hernández, Telesur, Mexico. I have a question. So what immunity do you acquire through having had the transmission, having had the disease? And can you have a reinfection? And so the booster, how long do you give protection through the booster to the population? Thank you very much, Dr. Barbosa. Yes, thank you very much, Javier, for your two questions. Regarding the first question, an infection, natural infection, contagion, gives some measure of protection. It has been confirmed, but it's not permanent protection. Unfortunately, as opposed to other diseases such as measles, where one person, once they've had the disease, of course, we don't have any more measles in the Americas, but when we used to have it, when the person was infected with measles, acquired protection for almost the rest of the life. However, since COVID is more like influenza than measles, so you can come down with influenza every single year. So the data shows that many people have had COVID more than once because protection decreases over time. And also many times the new variants are attack the immune system and they are able to produce a new infection. So many people think that because they had COVID-19 already, that the disease is enough and they don't need the vaccination. This is not true. There are thousands of cases, well documented, of people who have had a second infection due to COVID, and surveillance systems have documented this soundly in the Americas. So an infection is not guarantee of protection. And so regarding your second question about boosters, there's already a recommendation of getting a third doses. For some vaccines, it's not a booster. And let me underline this. Booster gives the impression that it is an optional dose, but for some vaccines, it's not. For Sinovac and Sinopharm, there is a recommendation already from WHO and PAHO that you need to have a third dose for older adults, for people with comorbidities, and immune compromise. And in those people, the immunity given by the vaccines after 4 months begins to decrease significantly. In other vaccines, or with other vaccines, the third dose is being recommended for certain special groups, those who with immunosuppression or immunodepressions, and other groups as well. So this needs to be assessed according to each vaccine, which behaves differently. What we do know is that protection afforded by the third dose is protection that lasts 4 to 6 months. And for some vaccines, as those used in the United States, there's enough data, and protection is up to 80% to prevent serious cases and deaths. So after that period, if you are afforded good protection, discussions of fourth doses needs to have a thorough analysis of data and think of people with immune suppression and other cases like that. We first need to prioritize, guarantee vaccination of all people in the higher risk groups, because this will allow us to avoid severe cases and deaths, and continue to use vaccines according to the strategy that was developed in each country. Unfortunately, with the information we have today, we need to continue to monitor very closely all the information, because we do not have one vaccine yet that is going to provide protection for many years. No, we don't have that information as yet, but these are safe, efficacious vaccines that can protect well people who have the full vaccination schedule, not with one single dose. Thank you very much. Thank you, Dr. Barbosa. Now, a question from Venezuela, Vanessa Davis from Contrapunto. Have you wondered to demand vaccination cards in tourist areas in Venezuela so that people can enjoy carnivals? This measure, does it help in the fight against the pandemic or not? Does PAHO recommend the use of a vaccination card to go to a carnival? Dr. Ugarte, thank you, Luciana and Vanessa. We had already answered the question before regarding public health measures and social measures vis-a-vis COVID-19 to reduce transmission in mass events, including carnivals and other mass festivities. So those measures are and continue to be the most important ones in reducing infections. However, vaccination against COVID-19 is the most effective measure to save lives and to reduce severe disease patterns. So that's why we recommend the populations to get vaccinated as soon as possible and follow the measures, social and public health measures that are recommended by the authorities. It is difficult to implement nationwide measures because there are differences among states or municipalities. However, when there is a large mobility of people, transmission can be increased because people move from one place to another. And so someone who is positive can go from a high transmission area to a low transmission area, and this would lead to continuation of the pandemic and of transmission. And this is more serious, of course, for people with comorbidities. They could have an aggravation of their comorbidities and other conditions, and they could die. A large percentage of people who are hospitalized and a large percentage of those who die are people who have not been vaccinated. And in this sense, it is very important that the population be vaccinated. Regarding the requirement of the vaccination card, many people have implemented those measures because of the reasons I've mentioned, the percentage of hospitalizations and deaths. But this can only be implemented when there is availability of vaccines, when there is a significant percentage of people who are protected and applying ethical and other measures that we consider vital at a time when vaccination is not accessible to the whole of the population. In addition, this measure is complementary to other measures that will reduce transmission and will maintain health services active and not overwhelmed, and not only because of COVID, but other conditions. Measures need to be adopted by countries considering their own epidemiological situation and as a complement to other measures that have been proven to be very effective to reduce deaths and hospitalizations. Thank you. Thank you, Dr. Ugarte. Now, a question from Costa Rica. Ms. Avalos from La Nación can ask the question live. Angela, do you hear me? Angela, if you hear me, you can ask the question live.
No. Okay.
It seems Angela is not there. I would like to have an assessment about Costa Rica's current situation in this recent wave and advance of vaccination in the regional context. Dr. Aldhigieri, please. Thank you for this question from Costa Rica. I would like to say, first of all, that PAHO's office in Costa Rica is working very closely with the health authorities, including the National Committee on Vaccination and Epidemiology. And therefore, my comments will reflect current data from the country. We've seen a decrease in the number of confirmed cases during the past few weeks. However, we still need time to begin to see that this decrease in cases will be seen reflected in the death and hospitalization curves, which are currently on a plateau. We've mentioned a difference of timeline already in several press briefings. There is a timing difference between the number of cases and the number of deaths, and it is related to the disease's evolution. Also, we need to take into consideration that care protocols in Costa Rica state that all hospitalized people should be given a COVID-19 test, and therefore people coming in for other conditions or accidents and who then turn up positive for COVID-19 are part of the national statistics that are public. I think it is important to emphasize that there has been a decrease in severity and hospitalization in the last 6 to 8 months. This situation is doubtlessly related to the increase in the number of people who have been vaccinated with the full scheme. So both adults and children have been vaccinated, and the campaign has been progressing with high percentages of full schedule. Over 73%, oh, it was 73.4 of the population is covered. However, we need to point out that approximately 250,000 people over 18 years of age have not yet received their first dose. And we know that the National Immunization Program is concentrating their attention on this fact. Finally, as a final point, I'd like to emphasize Costa Rica's achievements with their capacity for genomic surveillance, which allows to have a real-time follow-up of the dynamic of the variants of the SARS-CoV-2 virus. And Ciencia is one of the 8 regional laboratories of reference for genomic surveillance of the SARS-CoV-2 virus, and it is Costa Rica's lab. I hope I have answered the questions from the Diario La Nación. Thank you, Dr. Aldhigieri. Now a question from Peru. Yerson Collave from El Comercio has 2 questions. The first one, yes, in Peru, they are considering to stop wearing masks and do you think this is an appropriate time to start lifting the mask mandates? Thank you very much for your question. The use of masks has been an excellent measure to prevent deaths and severe disease. If we have learned something during this pandemic is when we relax measures when infections decrease and there is active transmission, quite likely, even if they are in low levels of infections, it's quite likely that cases will increase dramatically if measures are relaxed. And of course, transmission risk will increase. The decision to do away with the mandates has to do with the capacity of the health system to respond and the transmission level. But this is also related to reducing the number of deaths and reducing the impact on health services. However, there are other considerations to be taken into account, for example, the well-being of the population and of individuals regarding their economy, the country's economy, or the reopening of economic activity. So these measures need to be adjusted continuously according to the factors at national level, and they need to be measures taken both nationally and subnationally. And this is where WHO considers that in areas that have robust measures to control the virus spread, allowing relaxation of some of these measures for people who still have not been vaccinated or who have comorbidities could contribute to increasing the number of deaths. But at the same time, if there is a population who is vaccinated in high proportions and the health systems have high capacity, these measures could be gradually decreased in order to uh, reestablish economic activities. And regarding the specific point of the carrying out of events and celebrations, etc., WHO indicates that in the absence of cases in the last 28 days and in the midst of a pandemic with the variants that reappear or appear, mitigation of transmission needs to be done according to what is the surveillance capacity, the detection capacity, and also, as we had said before from the Caribbean question, what are the mitigation measures that are being adopted for the events that are being planned? In other words, there needs to be a risk analysis of each one of those events. And when it is considered that mitigation measures are not enough, then these events should be suspended or limit the number of people attending. So for public crowds, risk assessment needs to be done by the local authorities and the national authorities and event organizers. There needs to be contributions from all stakeholders. It is always an individual decision to protect oneself from COVID-19, but at the same time, it is a responsibility of the health authorities that whenever they decide to relax the measures, they should also adopt or have some responsibility measures regarding the impact these measure removal would have, considering that we will gradually need to reopen the economy, but with conditions of safety for all in health terms. Thank you very much. Thank you, Dr. Ugarte. Now a question about a vaccine from Andrea Meras, reporter from the Grupo Formula. Two questions. First, what advances do you have so that Mexico receives the agreed upon doses from from the COVAX mechanism, and when will they arrive? Second, PAHO has said that after vaccinating risk groups, then immunizations should start in minors. In the Mexican case, the government has considered to vaccinate this age group as soon as there is convincing evidence that there would be a possibility of vaccine. Well, We've been in negotiations, and we will be communicating with the health secretariat in Mexico about the dates when the 18 million doses will arrive. There will be 3 shipments because we cannot do it in one single shipment, but we will be we will be informing this officially to the health ministry in Mexico. Regarding the second question, each country has to assess their own vaccination coverage and the access they have to the vaccines they have available. So if a country has only 30% coverage, the priority is to the higher risk members of the population. If you have higher coverage, then you will begin to vaccinate youths and children. So you need to review the recommendations of the WHO regarding vaccination schedules. The recommendations given by the SAGE from WHO and also our technical group from PAHO. Yes, so we need to begin vaccinating the younger groups after having vaccinated the most vulnerable groups of the population so that we can strategically use the vaccines. The first objective is to protect those who are most vulnerable to avoid severe cases and deaths. Thank you, Dr. Barbosa. Now we have a question from Matias Loe in Spanish from Argentina. He asks, in Latin America and Europe and the United States, there is growing enthusiasm by governments to limit testing or lift mandates. And so beyond uncertainty about the pandemic evolution and the fatigue of the population, do you have any particular reason why you would recommend lifting these mandates, Dr. Ugarte? I think we've already answered this question, but I would like to complement my reply by saying that it has to do with detecting new cases. When there is a decrease in transmission and when measures are relaxed, it is likely that there will be a higher probability that detection systems in labs could provide results more quickly, but only if people go to those places and take the test. So relaxing measures has to go hand in hand with surveillance measures and also by conditions in which the community can show that they maintain the number of cases in low levels in such a way that you are doing the surveillance. So if you do not do the surveillance, you don't do the testing, if you do not detect new cases, overnight, we can have a significant increase in cases in a very short period of time. And this is what has led to the fact that relaxing measures leads to having to restrict movement and what some call the curfews, where there's absolute restriction of movement and lockdowns or lack of movement during certain times. So we will have to continue with basic protection measures using masks, for example. Physical distancing is another one, and always pay attention to symptoms so that those cases can be detected and adjust measures as epidemiological situations appear, and also bearing in mind the quality of healthcare services. Now we have a question in Brazil for Dr. Barbosa from Barrio Travassos from SBT TV in São Paulo.
Flavio, you can ask your question live if you hear me.
Flavia.
Flavia Travassos, please.
Olá.
Hello. Yes, we can hear you. Well, I would like to know what is the difference in reality between pandemic and endemic, because here in Brazil, they're talking about changing the status of COVID-19 pandemic, and if that could be a risk if we did that right now. Thank you. Thank you, Flavia. Dr. Barbosa, please, in Portuguese. Thank you, Flavia, for your question. In technical terms, we have a pandemic. When it started, we had an epidemic in different places in the world at the same time. That's normally what is generally considered a pandemic. An endemic, on the technical side, we talk about diseases that stay. They do not have an outburst and then they disappear. We have many different diseases that are endemic, like TB. And influenza as well is endemic. It's got some peaks during the winter, but it is with us all the time. So I understand your concern, because people want to have a time, a certain moment when we say, as from tomorrow, there's no more pandemic. Our colleagues, Dr. Sylvain and Dr. Ugarte, they have explained really well the characteristics of the SARS-CoV-2 virus. And we have to remember that even in this last 2 years of pandemic, we had very different situations of community transmission that was very, very strong, where harder and more severe measures had to be put in place. Others that were not as severe and that could be relaxed at some point. So I believe that this discussion in the Ministry of Health of Brazil today is not talking about that. They are assessing all impacts, legal impacts, regulatory impacts on these recommendations. And as our colleagues have said, it is important to ensure high vaccine coverage. So all risk groups, all that are eligible, that they have already taken the vaccine, and having a surveillance to make sure if there is an increase that would show that there is a new variant, or if there is a group of people who are not vaccinated and then they have an outbreak there. So surveillance is extremely important, and each country has to assess their own situation, because this is not going to happen in all countries in the world in the same manner, because they have different vaccine coverage, different testing capacity, and surveillance systems that are different. So countries that have this relaxing measures, they have to be in agreement with the epidemiological situation they have. So of course, what we have to avoid is to rush and to say, well, the pandemic is over, and to say that tomorrow we can relax all measures. The number of deaths in Brazil and the number of cases in Brazil show that despite all the progress that we've had in Brazil, they're very important, but we still need to follow on the same path to avoid death and other cases while we monitor the epidemiological situation, and we give support to the countries to make decisions on the measures that are consistent with the level of transmission that they face. Thank you very much. Thank you very much, Dr. Barbosa.
We have come to the end of our press briefing.
We have time for a final question on this topic. A question for the director, Dr. Etienne. Can you give us an update on the situation in Haiti and what is PAHO doing there? Thank you.
Well, thank you for that question. You know, since the start of the pandemic, PAHO has been supporting Haiti through the use of innovative COVID-19 testing strategies, like portable testing kits on motorcycles to reach the remote areas, and the activation of mobile hospitals. Also, we continue to work with the Haitian Ministry of Health hand in hand to ramp up the COVID-19 vaccinations in the country. Haiti received several shipments of vaccine doses in the past months, one large shipment from the United States of America. Most recently, 151,000 doses of Moderna were received last week, and COVAX is working with the Ministry of Health to ensure a steady supply of the Pfizer vaccine. As part of this national plan, the revised national plan for the deployment of vaccines, we are supporting the government strategy to increase the number of vaccination sites and the mobile vaccination units throughout the country's 10 departments. And this is made possible thanks to important investments in national cold chain operations. We are also helping the government investigate all reported cases of suspected adverse events following vaccinations, so that we can provide the best information on vaccine safety to the public. And finally, we are also supporting the ministry together with the CDC Atlanta in running a rapid survey on vaccine perception to understand better why COVID-19 vaccine uptake has been so low. And the result of this survey should help the ministries better implement its national communication strategy, and also the current rollout of risk communication and community engagement. We need obviously to see activities increase. Hopefully, as we carry out these engagements, the vaccine demand will increase, and Haiti will be able to meet this demand because they would have had the vaccines, the staff trained, and also sites closer to where people live. So as we end this media briefing, let me again appeal to particularly Caribbean people that we have to continue to be vigilant. We need to ensure social distancing, and also please, the best way to protect yourself is getting a vaccine. So let us be our brothers' keepers. Let us work with each other to ensure that we support all our neighbors, our friends, and our families to get vaccinated. Thank you again for being with us this week, and we look forward to seeing you next week.
Thank you very much, Director, for the final words. A los colegas, muchas gracias por la participación hoy.
To our colleagues, thank you for your participation. We have reached the time allocated for this week, but clearly we'll be happy to answer any follow-up questions or further requests you may have. Sebastián, my colleague, and Ashley also with myself at the communications office can address any questions you may have, and you can find more information on our website, www.paho.org. We thank you for your attention, participation, and see you next week. Stay in good health. Thank you.